This presentation is sponsored by the Griffith Allied Health Clinic's Physiotherapy practice, located on level 4 of the G40 building on the Gold Coast campus. This online presentation will briefly explore hip pain and hopes to educate you on what could be the source of your pain. The hip joint is a ball and cup-like structure, with the two main structures being the femur, the ball, and the acetabulum, the cup. Other structures that make up this joint are the labrum, which is a ring of cartilage that reinforces the ball and cup, ligaments, which act to support it, and surrounding muscles that aid in movement and strength. The hip joint is a major weight-bearing joint, and during walking, the forces going through the hip are 5 times that of your own body weight. If you think of the hip joint in layers, the deepest layer is bone, then ligaments that make up the joint capsule. These are both considered intra-articular, and then finally the tendons and muscles over the top, which are extra-articular. All are supplied by nerves, and when any of these structures are disrupted from excessive stress or strain, this can be responsible for your pain. People of all ages can suffer from hip pain. For the older patient, degenerative changes to a hip joint that occur as part of life, such as osteoarthritis, present in the majority of patients older than 60 years of age. For younger patients, hip pain can arise from repetitive microtrauma of activities of daily living. Both these types of patients often have difficulty with torsional or twisting activities, prolonged sitting, and rising from a seated position, with greater difficulty on inclined surfaces when compared with level ones. For the athletic patient, they develop during specific activities, such as kicking or high-impact single-leg loading like running and sprinting, where the hip and abdominal muscle activation may not be in sync. This can be from weakness, poor endurance, reduced flexibility, or poor coordination of these muscles. This can lead to instability at the hip joint, causing injury at weaker structures, whether that be bone, tendon, muscle, or cartilage. The morphology of the hip predisposes some patients to early hip pain, with such conditions as dysplasia, general hip disease, or early onset of arthritis. Hip pain can be acute, which is generally from a traumatic direct force, or chronic, where it happens over time slowly, whether it's from a previous injury or just general osteoarthritis onset. Intra-articular signs and symptoms are from damage at the hip joint surface, cartilage, or labrum and lead to what's called as mechanical symptoms. This can be clicking, catching, blocking, or popping during movement. It's described to be a constant dull pain that is sharp with movement. Location of the pains at the front of the hip or groin can go across to the leg and even around to the buttock. For extra-articular signs and symptoms, the pain is also to the front of the hip and groin, but can radiate more towards the midline of the body to the pubic region, down the inside of the thigh, or into the lower abdominals. Physical activity is generally the most provoking movement for extra-articular pain, as muscle contraction during movements. Movement also causes stretching of the ligaments and muscle, causing an increase in pressure on these structures. Conservative management can offer several different benefits. Of great importance is education. By informing you to what is actually occurring to your hip, how to manage the pain correctly, and a home exercise program to manage it best. Treatment is tailored to what part of the healing phase you are, whether it's the protection phase, which is help alleviate symptoms of inflammation, mobilization phase, to regain movement in the joint and restore range of motion, or the strengthen phase, help to stabilize the joint, allow correct positioning of the structures, and increase its ability to deal with high forces. Both long and short-term management strategies are considered according to where you're at. The end result is to gain functional restoration of your hip to full range of motion, mobility and movement, and diminish that inflammation and decrease your pain. The team at the Griffith Allied Health Clinic have over 10 years clinical experience each and are APA titled musculoskeletal and sports physiotherapists. They are experts in assessing, diagnosing and treating musculoskeletal conditions. If you believe you're experiencing hip pain and have some of the signs and symptoms described today, or you are uncertain as to the source of your pain, don't hesitate in making an appointment as soon as possible.